Hi, welcome to my third video on mental health. It's actually my third video. Thanks for watching, thanks for listening. If you're watching this on YouTube, don't forget to subscribe. The button is right about here. If you're watching it anywhere else, please don't forget to share, comment, like. Let's spread the message out there. Let's increase mental health awareness. Yeah, so today I wanted us to talk about anxiety disorders. I'm Dr. John Abatio. Well, you're probably asking yourself, anxiety disorders? Yes, anxiety can be a disorder if the anxiety is extreme, if it is not normal for a developmental age, if it is excessive, if it's persistent beyond appropriate periods, it is a disorder. Well, anxiety disorders share features of excessive fear and anxiety. Yeah, fear and anxiety, the two are quite different. Anxiety is the anticipation of a future threat, and it's usually associated with muscle tension, vigilance, avoidant behavior in preparation for the future change. While fear, on the other hand, is the emotional response to a real threat or to a perceived imminent threat. And fear is usually associated with surges of arousal necessary for fight or flight. There are quite a number of anxiety disorders, and they differ from each other, the type of objects or in the situations that induce the fear or anxiety. Yeah, but today in particular, I want us to talk about panic disorders. Yes, panic disorders. I have two reasons why I want us to talk about panic disorders. One, because panic disorders mainly entail panic attacks. Yeah, because panic attacks are used as a key marker for so many mental illnesses, to assess the severity, to assess the prognosis and the course of the mental illness. So many mental illnesses have panic attacks involved. Yeah, that's why I want us to talk about panic disorder. Another reason, I'll tell you as we go along. So let's dive right into it. Yeah, so like I said, panic disorder entails recurrent, unexpected panic attacks. It is normal to have a panic attack, but if the panic attacks are recurrent, if they are unexplained, you probably have a panic disorder. What is a panic attack? A panic attack is an abrupt surge of intense fear, intense discomfort that usually reaches the peak in minutes, and within this short period of time you can experience certain physical symptoms, quite a number of physical symptoms, examples of which are palpitations, a pounding heart, an accelerated heart rate. Someone will tell you, I'll get sweating, trembling, shaking, sensation of shortness of breath. You don't have COVID-19, but you feel you can't breathe. A feeling of choking, I think I said that, chest pain, chest discomfort. Someone could swear they're having a heart attack. Nausea, abdominal distress, pain, diarrhea. Can feel dizzy, feel unsteady, lightheaded, and can actually faint. Someone can get chills, heat sensations, feeling of unreality, like everything around them is unreal, like they're in a dream, or a feeling of detachment from oneself, like just observing whatever is happening from a distance. You can lose control, go crazy, fear of going crazy, fear of dying, bringing sensations in one's ears, neck soreness, headache, uncontrolled screaming or crying. So someone could experience these symptoms and they actually just have panic disorder. As a medical doctor, I get quite a number of patients. Sometimes patients are seeking a second opinion, probably a fourth opinion. Like I have this, I have severe chest pain, I get shortness of breath, I get trembling, I faint. But I was told whatever is wrong with me is psychological. They actually did an X-ray, probably an ECG, echo, whatever, different kinds of ambiguous investigations, and nothing is wrong with you. Yeah, and you're probably wondering what is wrong with me. You probably think probably your doctors have failed to find out what is wrong with you. No, whatever is wrong with you can be explained, please seek a psychiatrist. If you've been told things like that, if you experience symptoms and every time you go to hospital you're fine, you actually get diarrhea, you actually get vomiting, you get quite a number of symptoms, and it is sudden, it peaks in a very short time, seek health advice. You'll be sent to a psychiatrist if you need one. There's so many doctors out there. You get patients and they have all these symptoms that investigations are done and everything is normal. You examine the patient's oxygen is very normal, but they're telling you they just can't breathe sometimes, most of the time. They do not have, hyperactive airway disease. They don't have any other complication. Please, let's advise our patients to see psychiatrists. They can be helped. Yeah, and if you're out there, you probably have all these symptoms. You don't know what's wrong with you. You've been told whatever is wrong with you is just psychological. Maybe people are tired of taking you to hospital all the time because all the time the doctor says you're fine. See a psychiatrist. Another thing I wanted us to note is usually with panic disorders, you'll find that at least in one of the panic attacks, there is a persistent concern of worry about an additional panic attack. You're always worried, oh my God, is this going to happen again? What if it happens and I lose control? Am I going to go crazy? Or am I having a heart attack? And you're looking for ways to adapt, to prevent the panic attacks. You design behaviors to avoid attacks. You avoid certain situations. Probably avoid exercising because you think, what if I exercise, and I get a heart attack? You avoid unfamiliar situations because you're worried about any of these symptoms cropping up. You're worried about fainting in a very unfamiliar situation, in around people you're not used to. Something to note is worries about panic attacks or their consequences usually pertain to physical concerns, like worry that the attack reflects presence of a life-threatening illness. What do I mean? These patients will always worry, do I have a heart disease? Do I have a seizure disorder? Why do I always faint? The interesting thing about anxiety, about panic disorder, is that many individuals with panic disorders report constant feelings of anxiety that are more broadly related to health. They are often anticipating catastrophic outcomes from mild physical symptoms. For example, someone has probably a pimple and they're thinking, oh my God, could it turn into a cancer? They're always anticipating very big catastrophic outcomes from very mild symptoms. Could this be skin cancer? Could this be a lipoma? Or am I going to die? It's something very simple. It's, normal things that are happening. Give them a medication and could it cause me to have liver failure? Could it cause this? So normally in life we have daily stressors. We have life as it is, we all know it, But people with panic disorders are always worried, am I going to be able to go through the day? Because small stressor would panic them out. Many may exhibit extreme behaviors. For example, they will have severe restrictions on food intake. That's just an example. Probably they were told, if you eat this, you're going to get ulcers, for example. The avoidance of the foods, the concerns are usually extreme, considering, the expected consequences. And they're always worried about the situations that could provoke the panic attacks. It is actually very rare in childhood, but when someone has a panic disorder, sometimes you hear there's, a history of fearful spells that are reported during their childhood. Let's look at the risk factors of panic disorder. Risk factors, one is negative affectivity. People who are usually negative about life are at a high risk of getting panic disorder. People who have a history of fear spells, people who have experienced sexual or physical abuse. Smoking can predispose you to a panic disorders, and also it can be inherited. I think that's all I had to say about panic disorder, but thank you so much for listening. Next time we'll probably talk about another anxiety disorder, about another mental illness altogether. I don't know, we'll see. Thank you so much for listening. If you have any questions, please ask. We'll help you. I'll answer your questions. Till next time.